focus on the first 2 weeks. So if you look at the statistics, a lot of women start breastfeeding in the hospital, but by 2 weeks, they've thrown in the towel. And it's because they don't get this proper support that they need, and they deal a lot with pain. So my advice is if there's pain, there's a problem. The nipple's a ligament and you should feel it stretching and it should feel weird. I mean, there's no way to prepare your nipples for what they're about to go through. I mean, if you put your tongue on your roof of your mouth, you can feel a bump. Your nipple's going all the way past that bump in the baby's mouth. So it's being stretched. So you should feel that, but not bloody, cracked, sore nipples. So my advice is if you're feeling pain, try to get help as soon as possible. There's many tools to help and not feel guilty about it. It's all about, do the risks outweigh the benefits? And I'm glad you asked about nipple shields. That's one thing I want to talk about. It's all about just keeping going. If you hit a problem, not giving up, just pushing through and finding a solution and moving forward, because your baby needs that breast milk more than ever. So physical side effects, the main hormone that controls milk coming out, the delivery of the baby, is a hormone called oxytocin. So it's the love hormone, but it also helps things contract. So your breast is like a bushel of grapes. So it's got all these ducts and these little tiny sacs of milk. And when the baby latches on, or you latch onto a pump, it squeezes the sacs of milk, and that's what shoots the milk out. But oxytocin also contracts the uterus. So when you're nursing or pumping, that's one of the things you're going to feel is your uterus cramping. So you may have some bleeding, but it's actually good. We want the uterus to go back to its normal shape as soon as possible. So cramping and bleeding and feeling that uterus contract is completely, totally normal. So that's one thing that we don't talk about very often, but that's a completely normal thing to feel right when you first start nursing, and it should subside pretty soon, within a couple of weeks. Again, the nipple's a ligament, so it's going to stretch. There's no way to toughen up your nipple and get it ready. The only way to get a nipple ready for breastfeeding would be to put a vacuum on it and stretch that ligament, which and if you did that, you would release oxytocin and may go in preterm labor. So it's definitely going to feel like a ligament stretching. But again, if you put your tongue on your roof of your mouth, that's your hard palate. Then there's a bump. Then behind that is your soft palate. We can't really get our tongue all the way back there. Then baby's tongue is compressing the nipple against soft tissue. So there shouldn't be any pain. If there's bloody cracks or nipples, it's not going to happen overnight. You're not going to start bleeding immediately, but you will feel pain. So if you feel pain, my recommendation is to seek help as soon as possible before they turn into bloody cracks or nipples. Because what it is the baby is smashing your tongue or smashing your nipple against bone. And if you have a wound and you scratch it every 3 hours for 3 days, it's going to get worse. And it's the same exact thing with the nipple.